do you define poor? What is poor here?
Well, poor for us is what the nation says its standard for living is. It's what is it? $32,000 for a family of three in terms of living standards. So we follow the national data, the national federal standards for poverty, and this is based on how they define poverty. It's not a lot of money. It's not a lot of money. And if you want to get further down into that, $32,000 really is 200% of the poverty level. I'm sorry, because a lot of folks in this state are not eligible for benefits because at $32,000 they're kicked out. That would be the maximum line for which they can get some benefits for a family of three. So we're not talking about at the $50,000 level at all for families. I can get you more specifics on that. We are concerned about child hunger here in Louisiana. You would think, well, why not? Why are you worried about hunger? Isn't there a food stamp program? Yeah, there is a food stamp program, and there's feeding programs through schools, etc. But there's still children who show up hungry. Policies are not very friendly. Ask me, I manage them. They're not very friendly. Coming in to recertify every 3 months, save all your receipts, don't lose one, don't miss your appointment. If you do, you're cut off. Ask me, I live this. So yes, there's hunger. Hunger because of the literacy issues around how do you keep your eligibility going if you're very poor. If you don't work, depending upon your age, you can't get food stamps because you should be out there working. We have a lot of policies, public policies, that contribute to the issues that we have, and that's where a lot of work is needed so that we can get to those. I think one of the other big issues as a result of a lot of things, and more likely what we look at in data as a result of violent crime is grandparents raising grandchildren. And in Louisiana, in terms of the status of children, it says approximately 50,000 in Louisiana now that are being raised, that they know of officially by grandparents, children being raised by grandparents. Oh, there's nothing wrong with that. I was raised by grandparents. I think the issues that come from that is whether or not these folks have all of the resources that they need to be able to step in at certain points in their lives to take on child-rearing tasks. I think as public health professionals, you know that the role of leadership is so critical in terms of how it mandates certain qualities, and it's just as important in terms of how we heal our communities or keep our communities healthy as it is prescriptions, our health screenings, and other health protocols. But what I find in my work, and I think now I'm emerging more as somebody who's willing to take the risk to speak out, sometimes we're not ready to take that risk. We're not ready to take that risk of speaking out. I would say that post-Katrina is very clear that folks want visionary leadership. And I think I'm just so happy to be speaking to public health professionals because I think visionary leadership now is something that would be very important for you all to take on, not only with the course offerings, but to help the community understand how important some of these issues are that we're facing so that you can help change public policy. Help change public policy. You know what the outcomes are if a mom does not get quality prenatal care. You know what those outcomes are, but they need to be translated out there so that the community can appreciate what's going to happen so we can inform public policy and galvanize and mobilize people around public policy. It's not that there's an absence of knowledge in how we use that knowledge. And if there's anything I want to beg you guys to do is to become more of a public voice on those issues that impact families and children so that we can change public policy. As I mentioned before, Katrina ripped the mask off a lot of things. But 1 year later, where we find ourselves. On any given day, I can read reams and reams and reams of materials in our newspapers about public facility rebuild efforts. Every day. The road home, the recovery authorities talking about this, that, and the other. And it's just amazing to me that we could get the Superdome ready for September the 20 whatever, and we couldn't even get schools prepared for children to go back to school. Y'all, there's some stuff that happened here that we need to call people and talking about. The Superdome is going to be ready. Plush new leather seats. Plush new leather seats. And we let 700 children, is it 700 children, try to go to a school last week that's full of mildew and mold. Let the children had to go get the Southern Christian leadership, people from out of state to come here and fight for them to have a place to go to school. And then we want to know why our data looks like it looks. We want to know why our outcomes are as they are. We have not made children a priority, and we have not made them a priority in this rebuild. They are not a priority in the rebuild. If they were a priority, then schools would have been the first thing to get fixed. Schools would have been the first thing to get fixed. We would not be going to the city council on Thursday saying, well, you don't have any qualified child care centers up and running. Where are the children being kept? Who's watching these children? But yet we want hours and hours and reams of television coverage about the kids who broke out the youth study center. Well, they're breaking out of study centers every day. Not so prison centers, but out of homes that can't offer them anything and schools that rock. So, I mean, breakout is breakout. It depends on how you run out of it and what you're running away from. Okay?